Be open to some conversation. Think of your questions that might be blood related.
Awesome. Alrighty. So, Charmaine, if you could support by giving me co-host, and let's start the intro, Kinyofu. We know what this does. The community is aware, so let's jump in.
Are we recording?
We
Yes.
are recording.
Wake up, everybody. It's time to get up. Wake up, everybody. It's time to get up. Stay woke, stay woke, stay woke. It's time to get up. Stay woke, stay woke, stay woke. It's time to get up. We're healing, we're dealing, we're growing. Together, together, releasing. We're teaching, we're moving. Together, together, we're learning, discerning. We're striving. Together, together, we're leading, connecting, transforming. Together, together.
Good morning, good morning, good morning. Hello to everybody in the Wake Up family. For those of you who may not know me, because I know the space has been transformed and it's been quite a while since I've been in here. My name is Dr. Alexea. I am a triple board certified physician. I am boarded and trained in internal medicine, general pediatrics, and adult infectious diseases. I have been in practice for a little over 7 years. I'm currently practicing adult medicine and infectious diseases out on Long Island in the Stony Brook community. I'm also a mom, a speaker, an author, a health and wellness coach, and I am a breast cancer survivor thriver. And I create healing pathways so that others experience total health and wellness, mind, body, and spirit. So this morning we're going to be talking about the blood, and we'll talk about blood in sort of the informal context, the way we use it, especially as Black and Brown people. And then we'll talk about blood in terms of a little more of a formal context, just talking about the components of the blood. What does the blood do in our body? What's its structure and function? And then talk about a few common diseases of the blood, particularly those that impact our community. And then we'll wrap up with some questions and answers. As always, I want to be in conversation with you all. I don't want to be speaking at you or talking at you. So please do feel free to jump in with questions or give comments. I can see the chat as well. So let's get started. Let's get into these slides.
Shawnee, can you open up the sharing settings for me, please?
Absolutely. There you go, sis.
Thank you.
All righty. So you can move to the next slide, Kinyofu. So blood has been described as the lifeline of all beings. And when we talk about blood, or we talk about are in conversation, like regular everyday conversation about the blood, I think probably what most people think of is like how their lineage, how they're related to or connected to other people. I think about in the Black community especially, we claim everybody as family. So when we want to say that we are truly related to someone, we will specify that that's my blood cousin. Like, that's not my play cousin. That's my blood cousin, because it signifies that we're related. And so we talk about also bloodlines, right? When we talk about our lineage or our heritage, which is kind of an interesting conversation, because in the science community or in the medical community, yes, blood can signify relationship, but we think more in terms of our genetics and our DNA. And some of our blood is the makeup of our blood, or the constitution of our blood, like our blood type. If we have certain blood diseases like sickle cell or certain types of anemia, that is genetic, but our bloodline or our genetics or our lineage is not truly passed through our bloods. That's more of our gene code, but that's like one of the ways in which we think about or talk about blood. And beyond that, like in a social context, when we talk about family, when we talk about our relationships with people or our connections to people, there's that age-old adage that, blood is thicker than water. And so, we're more closely connected to the people who we share that bloodline with, who we share that DNA with, than the people who we might have friendships and bonds with it. So when you guys think about, blood, are there certain quotes that come to mind, or certain sayings that you all tend to use within your family or within your community around blood, and what blood signifies, or how blood connects us all? I'm just curious what that is like for you all, or what is your language around that? So I would invite somebody to come off of mute if they want to share, and then have you all share in the chat as well. Let's see, I've gotten rusty.
Yeah, let me start off by sharing that when we were kids, to demonstrate that we were clearly, or promising something and creating this agreement, we would put our blood together, like a little pinprick,
Yeah,
and then you rub the blood together to demonstrate that this is our bond, this is our promise, and it's unbreakable.
yeah. Yep, that was it was briefly a thing when I was a child. So I'm an 80s baby, and the HIV epidemic hit. And so when we were kids, to us, that was something you could no longer safely do, because we didn't understand how that infection was spread. And so in our minds, yes, blood is thicker than water, and Ebola says that in our minds, that was something that was dangerous for us to do, because in our minds, we thought we could give one another a bloodborne infection. And so, of course, being an infectious disease doctor, bloodborne infections is something that I deal with, but it's just interesting that as 6-7-year-old children, these were things that we were talking about on the playground. So yeah, like saying that you're now my blood brother or my blood sister by doing that little symbolic exchange of blood. Children don't do that anymore, I don't guess. I certainly haven't observed Kennedy or her friends to do it. But I feel like that was something that maybe phased out during our generation. So let's see, I'm in the chat now. So Cheryl says the blood shows out. But you didn't finish the statement, Cheryl. You want to come on and tell us about when the blood shows out?
Sure. The blood
Morning.
shows out is something that we say when you see like a great grandchild looking like a great grand past, someone that's passed, a great elder that passed, or you see extended family members that are distant and maybe you never met them and you see them and then they're like, oh my God, this looks just like my first cousin or whatever. It's like the
Yeah.
blood shows out, so
Yes.
that's what.
Yeah, we recently had that experience in our family. Somebody posted in our family's chat a picture of my nephew and a picture of Shawnee's dad, and it looks like the same person came back to the planet. And
Exactly.
I
That's
don't think I had ever seen that particular picture of my uncle. And so to see that picture of him and see how much he looked like my nephew was amazing. His my sister's children look very much like my dad and my sister, but also look very much like their father. But my nephew he looks like our uncle. And so they used to say, that's the milkman's baby. Um, we know good and darn well, like that's our baby. But it's amazing to see, that switch up of the genetics when everybody can look like one parent or the other or a mix, and everybody kind of looks like the same person remade over and over again. And here comes Lance looking just like Uncle Kenneth. But yeah, he's ours and we know he's ours. Jacqueline says, I had a college friend who has a quote where she would say, to be African, to be Black is the ability to hold all the blood. And that's a quote from R. Ferguson. Absolutely, right? When we talk about, again, getting back to genetics and getting back to lineage, when we say that all people originated in Africa and that all people originated from a Black woman because she has all of the lines to make up the genetics of the entire world's population. That's pretty amazing. And then Jacqueline added that the blood is strong. And she commented about the family situation. She said, yep, you my blood. Definitely one of those things we say. And she said, also, that's my blood, right? Getting back to those blood cousins. And then from Facebook, Rakia said, the red of the liberation flag, the red is for the blood that was shed. Yep. Hi, Stacy. Stacy says, blood equals family, blood is thick, blood equals oneness. And I think that's all I have in the chat for now. Anything that I overlooked from the supporting team?
No, I think you're good, cousin.
All right. So we'll get back into the slide and we'll talk about the formal conversation. Teresa said, as she's grown, blood relatives' view has changed. Yeah, so a lot of people, when they start talking about blood and our relationship to family and our lineage, some people will say, there's people who are closer to you or more loyal to you than those who you are connected to by blood. And so we can use it as a common denominator, a common factor, or something that binds us together, or we can look at it in another way and say, listen, there are people who treat you better than your own blood. So it could go both ways. Laura Joseph on Facebook says, in my family, we would say the bloodlines are strong, which refers to a particular characteristic or particular feature. Like, everybody has that nose or everybody has those cheeks. So in our family, we'll say, oh yeah, that's a Gaffney baby. That's our baby because the baby has our fat Gaffney cheeks, as one of our ways in which to say our blood lineage or bloodline is carrying on. So in the functional context, when we talk about blood, we're talking about the fluid, the liquid, the red juicy stuff that's traveling through our veins and arteries, our blood vessels that are being pumped forward by the heart. And what the blood does for us is it transports oxygen and it transports nutrients, those nutrients being calories, being vitamins, minerals, electrolytes, all of the things that we need to function at a cellular level to be an active human being. And then we also think about the blood as a transporter for waste products, right? Our muscles are constantly burning energy. There's a waste product for that. Our kidneys and our liver are processing the things that we have taken into our body and detoxifying it or processing it, and then we get rid of that waste. Some of that is transported, well, all of it is transported through the blood, and then exits the body, usually by way of the kidneys. as well as through our intestinal tract for some of those waste products. When we have oxygen exchange or air exchange, we think of air exchange, right, as us breathing in and out, but our lungs are in intimate contact with our blood, and we exchange oxygen and carbon dioxide when we're breathing in and breathing out, to keep our body going. And then, so our heart is a major player within the blood system. It's the pump that keeps everything moving forward. So a complete blood cycle or a complete cardiac cycle is when the heart pumps out blood. That blood travels through arteries. It goes through capillaries. Capillaries are the little tiniest of blood vessels where literally one cell is moving through at a time. And that's where the oxygen exchange takes place, or the exchange of nutrients takes place in any given cell or any given organ of the body. And then the blood returns back through the heart, through the veins. And once the blood reaches back to the heart, that completes a cardiac cycle, one revolution of the blood around the body. Next slide, please. So let's see, there's some other stuff in the chat. I don't want to leave out the chat, because it's always good and juicy in there. So Charmaine says from Facebook, Amadama says, back in the 70s, bloods meant Black people. So when did we go from Black people as the blood to the gangs, the bloods? Because they're still very alive and prevalent. Oh, and Jacqueline followed up. She says, now it refers to a gang. And then, oh, that's something I didn't know. So she says the movie Judas and the Black Messiah had a better name for the group of organized people who protected their community, right? And that's what some of these gangs did initially. And then the bloodline of the Benton family, they're over there loving on one another in the chat. I love it. So in terms of the components of our blood, remember I mentioned already, right? It's the red fluid that's pumping through the body. But within that red fluid are so many different types of cell lines and other types of fluid. So when we think about blood, we tend to think about it in its liquid form, but we separate out that there is a plasma, a protein fluid, and that protein fluid is actually kind of yellowish, and it's thin and it's clear. The blood gets its thickness and its color because the predominant cell is the red blood cells that we see up in the number 1 space. And then we have white blood cells, and there's several different types of white blood cells. And then we have what are called platelets. Platelets are our clotting cells. Our platelets are what stop us from bleeding out all over the place and allow us to close up or heal a wound. But if our platelets are overactive, if we have too many of them, if they become sticky, then we can end up with disorders of the blood like excess clotting, right? So we can have too much of a good thing, or our platelets can be overactive for various reasons. And then we can end up with clots in our legs, which can break up and travel to our lungs. And when we have changes in the chemistry or outside factors that affect the blood, then we can have all sorts of manifestations of disease. So we're still, unfortunately, in this COVID-19 pandemic. So with the COVID-19 infection, because of increased inflammation in the blood, the platelets become really sticky. The blood vessel walls become really sticky and inflamed, and platelets begin to stick there and form clots. And if those clots are like in your toes or your fingertips, you get that condition called COVID toes. That is a manifestation of complications of things going on in the blood and the blood vessels. People can get clots in the legs, which can manifest as swelling or pain in the legs. And then those clots in the legs can travel to the lungs and cause what we call pulmonary embolisms that can manifest as chest pain, shortness of breath, or difficulty breathing. People have even gotten clots of blood in their heart with this COVID-19 infection. And if it occurs in the COVID toes, Kathy, so like COVID, the virus infection that's going on, people get COVID toes. So they get this little spotted purplish red rash over the tips of their toes and fingers as a complication of a COVID-19 infection. So if you get weird rashes on your fingers and toes in this current season, you need to get checked for COVID. So back to the clotting in the heart. So you can either get clots in the pumping chambers, so platelets and red blood cells and, you know, the proteins in the blood all forming just a little clot or clump of blood right in the pumping structures of the heart. Or when that happens in the blood vessels that supply the muscles of the heart, that's how we get a heart attack. So if we stop the flow of blood, especially to our muscles, we end up with pain, we end up with cramping, and our heart, right, is a big pumping muscle, and our muscles need a constant oxygen supply in order to move and function. And so just like we get those muscle cramps in our legs, if we were having a heart attack as a result of, you know, clotting in the blood vessel walls, or the blood vessel walls being filled up with plaque from years of high cholesterol and other disease states, then we end up with chest pain because our muscle, our heart muscle, is hurting because it's deprived of oxygen. So the blood, I think, has so many functions that we just don't tend to think about, or you think about it from one perspective, but not the other. But our blood is constantly doing all of these amazing things, all of these complex functions for us from moment to moment. So we talked about the red blood cells, which, you know, carry our oxygen. And if you ever looked at blood work, if you've ever had a complete blood count, it's like the #1 lab test we order. Doesn't matter what's going on in the body, you're going to get a complete blood count. We want to know what's happening in that blood. It is critical to your well-being. It tells us so much about what might be going on with you acutely, as well as what may be going on in your body chronically. So even if you offer no complaints that relate to the blood, it's still going to be the first test that any doctor or healthcare professional orders on you. So when we look at a complete blood count, we're looking at the contents or the makeup of the blood. And so we look at the red blood cells, and the number of red blood cells and how much of your circulating blood is made up of those red blood cells are lab tests that we call a hemoglobin and a hematocrit. So people, when they're anemic, right, they know that they have, usually they'll say, oh, my hemoglobin is low. And the heme part of the red blood cell is made up of iron. The vast majority of the iron stores in our body is actually in our red blood cells. So if we're iron deficient, where we typically see that manifested is in a low hemoglobin, a low hematocrit. Sometimes the cells will end up being smaller than normal. And if we looked at them under a microscope, which is depicted under the drawing of the different types of blood cells, you see that most of the space on the slide is filled up with little red disc-like blood cells. There are some white blood cells in the middle of the slide, and off to the right side of the slide, there's a white blood cell, a monocyte over there that has that little kidney bean shaped looking nucleus. And remember, the nucleus of a cell is where all of the DNA of that cell is. So Jacqueline comments that she has thalassemia. So thalassemia, we'll talk about it because we're going to talk about common issues of the blood, Jackie. But you have to be careful with thalassemia because people with thalassemia always have a low hemoglobin and hematocrit. That is their genetic disposition, but they are not always iron deficient. And so you have to be careful that people are not giving you iron that you don't need, because you can absolutely have too much of a good thing. Okay. Yeah, you can have too much of a good thing. So somebody needs to know. So Charmaine from Facebook says, in reference to the blood, how it's reviewed in religious beliefs. Yeah, so certain sects believe that you should not receive a blood transfusion. I know that that is a practice of Jehovah's Witnesses and certain other cultures. We refer to the blood of Jesus. Yes, we refer to the blood sacrifice. We refer to the power of the blood. We refer to the cleansing nature of the blood spiritually. So it's something we're always talking about, even if we're not necessarily thinking about it from a physiologic respect, like we're talking about it now. We talk about the blood from a spiritual respect as well. And that was something that I definitely thought about in preparing for this conversation. So on the slides, it's all, science and physiologic, but I definitely want us to talk about the blood in all contexts. So just before we move off this slide, I just want to point out the different white blood cell lines. So neutrophils are the most predominant white blood cells that are in our circulation. You can think of those as your bacteria fighting cells. And then eosinophils, even though they're not the next most prominent number of cells, think about them as our allergic type of cells. So they are the ones that are responsible for your allergic reactions to things. But eosinophils also interestingly rise when people have parasitic type infections, because parasites give us an allergic type of response. Basophils interact on various levels, but they're not in major players for the things which we'll talk about in the context of this conversation. Lymphocytes are our virus fighting cells. So with viruses, lymphocytes will either increase or decrease. With COVID-19, people have what we call a lymphopenia. So their white blood cells drop dramatically, okay? Also, when we talk about infections that impact the blood, it is our lymphocytes, our T lymphocytes or our T helper cells that HIV virus infection attacks those particular cells. And then our monocytes are another type of white blood cells that are really only active in very specific infections, atypical infections like tuberculosis and things like that. Next slide, please. And feel free to jump in with questions, guys. So we talked about the functions of the blood cells in circulation. We talked about them transporting oxygen. We talked about the platelets forming clots to prevent excess blood loss. But if we have too many of them, or if they're overactive or overly sticky, or if there's inflammation in the body, we can have excess blood clotting, and that can be pathogenic or disease forming. And we talked about the transport of waste from the kidneys and liver, which filter and cleanse our blood. And our blood also helps regulate our body temperature. So, I don't know if anybody here is from Texas, but thinking about our people in Texas who are right now dealing with unprecedented snow, unprecedented freezing temperatures. We're talking, the medical community and people who are in the military are advising folks who are without heat and without electric to kind of huddle together because of the way the blood behaves when it needs to keep our body warm. So our body is always thinking about preserving the brain and preserving our organs. So when it's freezing cold outside, what happens is the blood vessels in our fingers, our toes, our skin sort of constrict to decrease the blood flow to those areas in favor of protecting the brain, the heart, the muscle, the liver, the kidneys, and the intestinal tract, the vital organs. So when it's cold, our core will be warm, but if our fingers, our toes, if our nose are exposed, that's where we end up getting frostbite, right? Because our body is trying to keep those vital organs warm, trying to maintain our core temperature, right? So we hear that. And then in terms of other ways in which temperature can be regulated, think about when you get sick, you get a fever, right? The temperature is increased. And then if you have infection at certain sites in the body, like if you had a skin infection, you can see that site will be red because there's increased blood circulation to that area, so that More oxygen can be delivered to that site, more white blood cells can be delivered to that site, important proteins and inflammatory markers that are part of what we call immune cascades can go to that site and fight infection. So we will observe an infected area as being red, or it'll be hot to touch, and sometimes that can come along with pain. And then we can measure in the blood that the white blood cell count that is circulating will be increased or elevated, because our bone marrow is like, hey, we got an infection, go out there and fight it, and it'll start pumping out white blood cells to send to the area. And then other places we can find blood will be like, let's say you have a urinary tract infection. Your body will send white blood cells to that area to fight the infection. So when we collect a urine specimen, even though it's not normal for blood to be in there in the setting of an infection, you will see white blood cells and sometimes red blood cells in that area because of the way in which the body is trying to protect itself and preserve itself. Next slide, please. And then Abimbola had a question. She says, I have white spots on my legs, body, and arms. Is that related to white blood cells? No. So depending on what the white blood cell, what the white spots are and their patterns, it could be just totally benign, like just loss of pigmentation in a particular area. And that might be something that is hereditary for your family. Or it could be something like vitiligo, where we lose the pigmentation in our skin. That's something that is autoimmune mediated, but it's not related to white blood cells specifically. So when we're talking about blood types, right, we know about, oh, Stacy has a question. She says, can't anemia be reversed? Absolutely, it can be reversed depending on what type of anemia you have. So she says, I thought with increasing iron intake, like leafy green vegetables, it can be reversed. She was told when she was younger she was anemic, that's why she's cold. Yes, absolutely it can. And we're definitely going to get into more details about anemia. Iron deficiency anemia is one of the most common types of anemia, but there are other nutrient deficiencies and other factors that are involved with iron deficiency. So we'll definitely talk about that. So we'll get into these blood types, right? So there's 4 main blood types, and they are A, B, AB, and O. And that is just determined by the presence of antigens or proteins on the blood cell, on the red blood cell surface. So if you are blood type A, you have group A antigens or proteins on your blood, and in your body circulating in your plasma or in your blood, you have anti-B antibodies. So antibodies are the factors in our blood and in our immune system that attack foreign things. And so we have some innate immune memory, like with our blood types, and then we develop immune memory, like when we get vaccinated or when we experience certain infections, we'll have antibodies in our circulation that recognize these foreign things and help us fight off infections. If you're group B, you have type B proteins or antigens on your blood, and you have anti-A antibodies. If you are AB, meaning you got an A blood protein from one parent and a B blood protein from another parent, then you will have both A and B antigens or proteins on your blood, but you don't have any of those antibodies in your blood. And then if you are blood type O, you don't have either A or B antigens or proteins on your blood cells, but you make antibodies to type A and B blood. So why is this important? Well, it used to be the old way of determining, you know, are you the father or not? But obviously with this very limited group of factors, it's very hard to tell, because 2 people can have the same blood type, right? So sometimes it worked and sometimes it doesn't. But where this becomes important is if we're talking about being the recipient of a blood transfusion or being the recipient of an organ donation, then people who are blood type O or group O, they are considered the universal donors. They can give blood to everybody. because their blood doesn't have those foreign proteins that other people's immune system would recognize or attack. People who have AB blood, they are what we call universal recipients. They can get blood from someone who is blood type A, B, AB, or O. And then the people who are group A or group B, they can only receive blood from people who are group A or group B. Next slide, please. So blood donation is something that is very, very important to do, especially for us as Black and Brown folks. You know, our genetics are very specific to us. And so it's very difficult to, not very difficult, not exceedingly difficult, but there are challenges around getting blood that is matched for us sometimes. So when you think about like our brothers and sisters who are dealing with sickle cell disease or, you know, different types of sickle cell anemia, who are transfusion dependent, folks who have things like leukemia, lymphomas, which are blood cancers, people, you know, who have other diseases that make them chronically anemic and they may need blood transfusions. It's very helpful if people who share genetic lineage with them can donate blood so that they can be recipients of that. There's other antibodies and other factors that are at play when you know, do a type and screen, or when you cross match for somebody for blood, you're looking at other antibodies besides those in the four major blood groups. And so it's very important for someone who's Black, Brown, or of any sort of ethnic origin to be able to receive blood and or organ donations. And organ donation doesn't always mean like a kidney or a piece of your liver. It could even mean like a bone marrow transplant, where somebody, you know, just takes some of your cells from your bone marrow and transplants that into someone who has a disease of the blood, of the bone marrow, or of the blood forming organs. But we tend not to sign up for those things. So please, please, please do consider signing up. And in the midst of this pandemic, because we're not able to host blood drives, less and less people are donating compared to normal. There are those people who, you know, always go and donate blood. And then there are people who, you know, they'll spontaneously donate blood when they see those pop-ups at, you know, their workplace or a hospital or their church. So if you guys were previously donating blood, or if you've never done it, please do consider it. You can reach out to the American Red Cross in your local hospital. It is absolutely safe to donate blood at this time. Even in the COVID-19 pandemic, those would be places and spaces where they create safe spaces for you to donate blood. And as it relates to the COVID-19 pandemic, one of the ways we treat people for COVID infection is we take the blood, specifically the plasma component of the blood, not the cells, but the plasma that has antibodies circulating. And if somebody gets a COVID-19 infection and recovers, they can donate their blood, and a lab will separate out their plasma and transfuse it into people who are affected by COVID to help more quickly resolve their infection, which is pretty cool. So we can use someone else's blood to treat another person who's dealing with an infection that they have already overcome. And that's not unique to COVID or new. We've definitely done that before. Let's see. So Cheryl asked about ABO incompatibility. So if your child has a different blood type than you do, and as well as a different Rh factor than you do, which is a perfect segue, Cheryl, what can happen is your immune system can start to recognize your baby's blood as foreign invaders, because sometimes there's exposure across the placenta. And so we will make antibodies to the baby's blood if the baby has a different blood type than the mother. The same is true for the Rh factor. So our Rh factor is a factor on our blood cells as well. And most people are Rh positive. So where this becomes an issue is if mom is Rh negative, she doesn't have that factor on her blood. When she has her first pregnancy with a Rh positive baby, she will make antibodies, to those Rh proteins or antigens that live on her baby's blood. And then when she has a subsequent pregnancy, the next baby is in danger because her immune system is primed to attack that baby's blood cells. So the baby can be born with anemia. The baby can be born with destruction of the red blood cells, which can lead to jaundice, which is what Cheryl mentioned. And this can happen as well if there's ABO incompatibility. So you have one blood type and you make antibodies to the blood type that your baby has. So their cells get destroyed, and the destruction of the red blood cells in a newborn baby whose vital organs are just waking up and not as readily able to process the breakdown products of those red blood cells will present with jaundice. So yellowing of the skin and yellowing of the eyes. Jacqueline adds that both of her children were jaundiced at birth. They didn't have to undergo Billy treatment with the lights. We call them Billy lights. So literally light applied to the skin can break down bilirubin and help us process it. So Veronica asked the question. She says, I used to go before breast cancer. Why is it that I'm no longer allowed? So before my cancer diagnosis, I used to be on the list for a bone marrow transplantation, like to say I would give my blood or give my bone marrow if someone needed it. So what happens with cancers is that even when you don't have active disease, you can actually have cancer cells circulating in your bloodstream long before you have a visible solid tumor that can be detected on the types of scans that we get, like PET scans and CAT scans. And so cancer patients can no longer donate blood because you don't want to transmit those cancer forming cells to another person because they can theoretically propagate. So we're no longer able to be blood or tissue donors once we've survived a cancer. And then Afua says she was advised not to donate because she has thalassemia. Right. So people with thalassemia don't have a normal hemoglobin and hematocrit. So that's the portion of their circulating blood that is made up of red blood cells, because genetically you have lower counts. We don't want to take away a significant portion of your red blood cell count, because then we make you more functionally anemic. So you may end up with fatigue and dizziness and lightheadedness and faintness and be cold and be short of breath because your hemoglobin will be even more decreased than it normally is and more decreased than your body would be able to tolerate. So let's see. So Bianca on Facebook says, did the Rh factor really come from humans mixing with animals? How did it get introduced in the blood? So the Rh factor, Rh actually stands for rhesus, like rhesus monkeys. And it's probably more of an evolutionary thing than it is a matter of, mixing of species. It's just more of a common genetic lineage thing. So when we name certain factors, we name them based on where we find them. Stacy said, oh Lord, where we find them or where they're first discovered, excuse me. So this Rh factor was probably discovered in these rhesus monkeys before it was discovered in humans. And then so it was named that. So that's that. So let's see. Jackie says she went to get x-rays and the technician told her that she recovered from COVID, but not to be concerned because she has antibodies and she can never spread the disease again. That's not true. Oh Lord. I'm gonna come back on and we're gonna talk about COVID and talk about COVID vaccines because there's so much misinformation out here. It's unbelievable. So that's not true. So if she did not actively have a COVID infection, she can't transmit an active COVID infection because she doesn't have one, right? But she can get COVID again, and she can transmit COVID just same way everybody else can, breathing, coughing, sneezing, talking, laughing, if it's in her respiratory passage. Next slide, please, Kinyofu. Let's see, just going through the slides. So somebody commented about having very small blood cells, which is what happens in thalassemia. You have tiny red blood cells, smaller than normal, and so people think that you are anemic, but you're doing what you're genetically predisposed to do. All right. So when we talk about blood illnesses, right, everybody immediately landed on the most common blood illness that we hear about, and that is anemia. So anemia is simply fewer red blood cells in the circulation than is normal. And so if you look at the graphic, there's a depiction of normal red blood makeup, excuse me, where you see there's a density of the red blood cells, but in anemia, there's fewer red blood cells, and within those red blood cells, there's less hemoglobin. The hemoglobin is made up of iron. That's what we're referring to when we talk about heme in the hemoglobin or heme in our blood. So with iron deficiency anemia, it can be for a couple of different reasons. It could be because you're not taking in enough iron in your diet, or it could be because you're losing excess iron. Either you're bleeding or your red blood cells are being damaged. Those are the most common modes. You either don't take in enough or you're losing it in excess. So for the adults in the room, especially folks over 50, if you've never had anemia and all of a sudden you become anemic, you need to get iron studies. You need to get studies for things like B12 and folate levels. Those are another common nutritional deficiency associated with anemia. And then you also need to get checked for blood losses. The most common place for folks over 50 to lose blood is in their gastrointestinal tract. So we'll often do a colonoscopy to make sure you don't have a colon mass, ulcer, or lesion or cancer. If you're over 50 and you present with new onset of anemia. And then we'll also do like an upper endoscopy if you, have things like chronic heartburn or other conditions like that. For Black and brown folks, there is sickle cell anemia, which is a genetic anemia that is associated with pain crises. And we'll talk about sickle cell. I have a whole slide dedicated to that. And then I already mentioned vitamin deficiency anemias like B12 and folate deficiencies. And then folks in the chat brought up thalassemia. So thalassemia is a genetic predisposition to anemia, but the people who are who have thalassemia or thalassemia trait, even though they have lower than normal hemoglobin and hematocrit levels and smaller red blood cells than the general population, they often are not iron deficient. So you have to be careful that doctors aren't giving you iron without checking to see if you have thalassemia trait, and they need to check and see if you're truly iron deficient, because you can have too much of a good thing, and excess iron or iron overload is harmful to the liver. It can be harmful to the heart, and we can have other issues as a result of taking in too much iron. It can damage other organs as well. So, don't take supplements that you don't need. Make sure you need them before you prescribe them. And if you have thalassemia trait, when your doctors are going over your blood reports, make sure you inform them of that, because people will constantly get worked up for iron deficiency when all they have is thalassemia. Literally every time they meet a new doctor, they'll be like, oh my God, you're anemic. Now I got to do an iron panel on you. Don't waste your time, your blood, or your healthcare dollars on that. So that's that. Next slide, please. So with sickle cell anemia, so John, yes, our John has sickle cell disease, sickle cell anemia. So sickle cell anemia is most prevalent amongst Black folks and people of African descent, but we see it in plenty of other cultures, Hispanic, Latino cultures, or people. We see it in people of, Asian and Middle Eastern descent. And people can have sickle cell anemia or sickle cell disease where they have two sickle hemoglobin traits, meaning they have inherited the gene for sickled blood from both of their parents. That's sickle cell disease or sickle cell anemia. And then you can have sickle cell trait, which means that you have one gene for sickled blood, but your other blood gene is normal, or your hemoglobin gene is normal. And so you don't usually manifest the symptoms of sickle cell disease, although those people may be anemic. So common symptoms of sickle cell anemia is actually anemia, right? Because the red blood cells get destroyed or damaged, and we'll talk about how and why. In relationship to that, people have episodic pain crises, and pain is one of the hallmarks of sickle cell disease. And it is a particularly challenging disease to have managed as a Black person who has to go into healthcare systems that falsely believe that Black people can tolerate more pain than white people, that falsely believe that, Black people are more likely to exhibit pain-seeking behaviors. And what they mean by that is they think that, Black people are more somehow predisposed to come into a hospital and ask for pain medicines that they don't need. But pain management is one of the hallmarks of managing sickle cell disease. Frequent infections are part of sickle cell anemia. People can have short stature or delayed puberty because of the chronic anemia and the chronic illness and disease state that comes along with that. Visual disturbances, if the blood vessels of the eyes become involved. We can see jaundice or yellowing of the skin or the eyes, because when the cells sickle, they damage and they release the hemoglobin or that iron. And the breakdown of blood products includes bilirubin, which that is what makes the skin and the eyes yellow and makes the urine dark when someone goes into pain crises. So literally, if you know someone who is impacted by sickle cell anemia or sickle cell disease, when they're in crisis or going into crisis, sometimes their eyes begin to become yellow. So one of my very good friends who we went to med school with, she would often go into crisis in our lectures because the lecture hall was freezing cold all of the time, and you would see her get jaundice as the lecture was going on. Major complications of sickle cell anemia include things like stroke, organ damage. So sickle cell patients will often lose their spleen, or their spleen will become afunctional. And our spleen is one of our major organs that's important in helping our body recognize and fight infections. Sicklers can get something called acute chest syndrome, which can be life-threatening. It's almost like having a sickle cell crisis in your lungs. And it can also be associated with pneumonia, and it can be life-threatening. So that is critical to identify. So people with sickle cell anemia will always get a chest x-ray when they come into care for sickle cell crises. They can get gallstones because of that buildup of bilirubin and breakdown of the blood cells. Joint swelling is a common manifestation of the condition, because that's where the pain is often experienced, in the joints, in the bones, in the muscles, because of oxygen deprivation in those areas. In infants, small children, when they lose their fetal hemoglobin and they start to produce their mature red blood cells, when they have their first crises, it is often an inconsolable infant with hand and foot swelling. And pregnancy complications can include things like frequent miscarriage, premature birth, low birth weight babies, because it's a stressor on the body. So sometimes they will preemptively transfuse pregnant women who have sickle cell anemia. There can be organ damage. I mentioned the damage to the spleen. There can also be damage to the kidneys, the heart from the chronic anemia, damage to the lungs, which manifests as what we call pulmonary hypertension, so high pressure in the lungs. A complication of that is heart failure. Priapism is actually prolonged penile erections in men who experience sickle cell anemia, because literally the blood passageways get clogged up when the cells sickle, and so the blood cannot exit the penile organ normally. And so if a young Black man comes into the emergency room with a prolonged erection, if they don't already have a diagnosis of sickle cell and they didn't take some Viagra or something, that's a disease we're thinking about. Leg ulcers or ulcers in the distal parts of the extremities, because again, we're talking about damaged or interrupted flow of blood in those very small blood vessels, those capillaries where the cells are passing through literally one at a time. In sickle cell, where you see those sickled or almost boomerang shaped red blood cells, those are the sickled cells, and that occurs when the body is under stress, when there's dehydration, when the oxygen is low, when someone is cold, their cells will start to sickle. And when the pain is not managed in a sickle cell crisis, the stress on the body actually causes more of the cells to sickle, and it can make the condition worse. So when you're talking about people in Black and brown bodies with a pain syndrome having to go into a healthcare system that doesn't believe their pain, that poorly manages their pain, they actually perpetuate and worsen the condition of a person who is dealing with sickle cell. And what happens is those sickle cells are stiff, and they don't fold and bend the way the normal red blood cells do. So they, instead of just passing smoothly or freely through those single cell pathways, those capillaries where blood is literally marching through one by one, where all of that very important and intimate oxygen exchange takes place, those sickle cells get stuck and they can clog up those passageways. And so you're talking about having cell death and cell damage, and that's what causes the pain. John says absolutely the majority of his pain crises were linked to being overly stressed. John, if it's okay with you, can I invite you on just to share? I know you've shared about your experience with the community. But if you're willing to, I definitely would love to hear your voice in this space right now, just to talk about that.
I'm willing.
Oh, thank you so much. So you mentioned dealing with stress, right? And stressors on the body can be many, but can you just give us a few examples about how stress has impacted?
Yes, and I hope you can still hear me. It seemed like you froze a bit on your side. Okay, good. Yes, stress. With stress, and it took me a while to identify what it was that would cause the sickness. But at one point in my life, I found that every month, towards the end and the beginning of the month, I had to be cautious because I could feel that my body was being susceptible to breaking down. Being born within 49 years now, I've learned to sense when an attack is coming.
Yeah.
Stress, like I said, is the most prominent issue that had caused my illnesses. But when the temperature drops and there's impact in the atmosphere, I can tell when it's going to cause a crisis. And many of those cases, I would take time off and just relax, lay out. Even if I wasn't tired, I'll just stay still and allow whatever it is to pass through.
Yeah.
In the past years, I've found that marijuana has been a great a great medication that helps in helping me in relaxing. And we talk about pain medications. There was a time when I went to the hospital and they just kept recommending the Tylenol with codeine
The
and all
opiates.
these other
Yeah.
high medications, which caused me to hallucinate. And I refused to take them anymore. And when I discovered that weed, marijuana, medical marijuana, did what these painkillers did, it had the same effect without the hallucinating. I mean, except for happy and hungry and so I use marijuana for the purpose of balancing this, not only after a crisis came up, but also when I felt anxiety and stress beginning to impact.
Yeah.
It's crazy because, like I said, it was only later in my life that I discovered that. And at 18, I stopped. Between 18 and like 22, I stopped taking all kind of medication, pain medication,
Wow.
and started eating and developed a healthy eating habit. And just decided to challenge it. You know, whenever if I was if I was in the right mood and I felt a attack coming on, sometimes I didn't pause. And I had felt that when riding my bike in several cases, and I just pushed through. And many of those times I got sick, but every time I got sick and had to be hospitalized, I learned something different about the energy, so to speak, energy effect. Like
Yeah.
the last time I was sick, the pain attacked my back. And whenever I had attacks in my back, I would literally be crippled several times where in my younger years, in my early 20s, where I could not walk. And in my last 2 years ago, I got sick after riding my bike. And I had exhausted muscles in my back, which caused the effect to come on. They treated me with, I believe it was morphine, which didn't do anything for the pain.
Yeah.
I was still hurting all the way through it, no matter how much shots they gave me. And then I later discovered, I don't remember what this medication was, but what I learned in that episode was that it wasn't so much the sickle cell attack, it was the
muscle
muscles that were
injury. Yeah.
exhausted. And
Yeah.
when I got treatment for the muscle pain, I personally was then able to balance anything that came in the way of sickle cell. So with a sickle cell patient like myself, if I'm active, and if you are active and you get sick, sometimes it's not always sickle cell,
Right.
the sickle cell pain. And I've learned how to understand and vibe. There's a vibe, there's a feeling. Learn how to
Yeah.
balance it.
Yeah. You know, I think anybody dealing with any chronic disease, but especially sicklers, are very in tune to what their limits are and, exactly how much they can do, how much they can push, and, can even get to a point where they sense or know those, that a crisis may be trying to come on, and they know to rest, to hydrate, if necessary, to try to get ahead of the pain. But you have to be careful to point out when your symptoms are different, or point out that my pain typically responds to this and it's not, so that people can explore other conditions. Because in the healthcare system, people get lazy when it comes to us, or people get tunnel vision when it comes to us. And so you don't want to be getting fluids and pain meds if your chest pain is really a heart attack and you need to be going to the cath lab. So or if it's acute chest syndrome and you need antibiotics and critical care and so many other things. So, it's a beautiful thing if you can go into a center that has a sickle cell team or a hematology team, or go where people know you well, so that you don't have to deal with some of the madness and the disparate care that we often experience. So thank you so much, John, for hopping on and sharing.
You're very welcome. I saw the question there, what does it feel like? And very, very painful. A doctor explained it to me in one of my earlier years as like sucking a grape through a straw, if you can imagine what that would feel like through the vessels, through the blood vessels. And with an attack, I can sense where the muscles in my legs, back, arms, or whatever, where the muscle becomes very fatigued and there's no energy, no chi, as I believe it was Stacey that asked that question, no energy flowing through that area.
Yep.
So it's stagnant, it's limp, it's heavy, and it's just painful. It's like my my legs. I remember one time, my 20s, my first attack here in New York City, and I went back home and my legs literally felt like noodles, and I had no energy, none of that life energy flowing through my muscles in order to move them or anything. So yeah, and something you mentioned just now about the tunnel vision. If a physician may have tunnel vision and they're treating you everything for what they know you have, and it's not always that.
Right.
So that was very important.
Yeah.
And I'm grateful. I'm grateful to be alive, and all the challenges. Honestly, I think the one thing that worked most for me is the fact that I don't let it bother me, because that's where the stress comes in. I'm sick, I'm gonna get sick. I have amnesia when it comes to that. I forget.
Yeah.
And if it happens, then I'll treat it when it happens. But that's what's working, and I don't have the effect like I did when I was younger.
Yeah. Stress is a real thing, and it has real impacts on our blood. It produces inflammation in our blood. It decreases our white blood cell counts. It, suppresses our immune system. And so stress can be a real killer. And so in a situation like yours with sickle cell, you can, pick up clearly that manifestation of stress, right? They can measure that you're more anemic than usual. You experience the pain, and you can rate that pain, which is another objective measure of how stress is impacting the body. But those of us who don't experience stress in that way, we will continue to stay in the space of stress because we don't have we don't perceive the outcomes of the stress on our body. So it's certainly not a gift to you to be able to experience your stress that way, but it's a curse for those of us who are not in tune with the physical manifestations of stress on our bodies, because we'll stay in that rut, we'll stay in that space, and it's harmful. People have had heart attacks, and strokes as a result of stress and anxiety, because they can't release that energy, or they can't reverse that feeling, and there are major implications. So thank you for sharing how powerful it was for you to be able to release that kind of stress and anxiety.
Thank you. It's my pleasure.
All right, let's go back to the slides, Kenyofu. And then we'll proceed to the next one. All righty. So, I mentioned about stress causing low white blood cell counts. Anemias are low red blood cell counts. And one of the things that's common for people of African descent, certain Jewish populations, and certain Arab populations is what we call ethnic neutropenia. And I actually have this condition. So at baseline, our white blood cell counts are generally very low. And remember, when we have these quote unquote norms, the norms are really based on white populations, right? And so Black and brown folks can have really low normal white blood cell counts that are normal for them and really of no consequence. So if you have a low white blood cell count, specifically low neutrophils, those bacteria fighting cells that I showed you guys on that blood slide, as long as you're not getting chronic infections, it's considered to be a benign condition. It's of no consequence. And so I was fine until I needed chemotherapy, and my white counts would plummet. They would go to, 3 digits, like 800 white cells. And so they would delay my chemotherapy because they didn't want to make those numbers any lower, because they may put you at risk for infections that you would otherwise not be susceptible to. And if you get a fever when you have a very low white blood cell account, it's a critical emergency, and they'll often put you in the hospital for that. And, you know, it's the last place you want to be. So it's important to know your baselines and your normals, or what the trends of your numbers have been over time, and have that assessed. But again, remember, we mentioned that stress can decrease your white blood cell counts. Nutritional deficiencies can decrease your white blood cell counts. So the same nutritional deficiencies that can cause you to have anemia or a low red blood cell count, like iron deficiency, vitamin B12 deficiency, folate deficiencies, those can also suppress your white blood cell counts. So when I was on chemotherapy, one of the things that I began to do was to supplement with B vitamins, folic acid, but I didn't take iron because I wasn't anemic and I didn't need iron, but I supplemented in order to help keep my white blood cell counts more robust. Because when you're in a treatment like chemo that's damaging cells all over your body, you can become nutrient depleted, because your body is trying to generate new cells that get damaged when you're going through these cycles of treatment. So it's important to know what your nutritional status is, know if you're nutritionally depleted for a particular vitamin so that you can supplement for that. Someone asked about aplastic anemia. So I had aplastic anemia on my anemia slide, and then I took it off, but because it's less common. But people who have aplastic anemia, if it's truly aplastic anemia, it means that your bone marrow cannot produce red blood cells. And that can be regardless of nutritional status. It would be important to make sure you replete your iron stores, because you can't make blood if you don't have appropriate iron stores. But if you truly are aplastic, you are 100% transfusion dependent. And there's not a supplement in the world that's going to make your bone marrow produce cells. It's dysfunctional bone marrow. And so those people are transfusion dependent. When you're transfusion dependent like that, it's very important that those patients are managed for iron overload. So those are people who need chelation therapy or chelation type medicines, so that their liver doesn't harden from excess iron. Because if you damage the liver, you really have big problems. So you have to take drugs like desferoxamine and things like that that help get the excess iron out of the system. Because when you pour in red blood, you're literally pouring in iron. And the body will typically recycle the iron if it's not exiting the body by way of a menstrual period in the case of women, or if you're not losing it in the gut, if you're not having GI bleeding. So you can get iron overloads when you're transfusion dependent. So that's something that's very important for someone. And again, one of those things that I've seen just overlooked in the medical community. You know, someone's getting their 10th or 20th transfusion and no one has given them anything to get rid of the excess iron. Next slide, please. Thank you for bringing that up. So let's see, Charmaine put in a comment from Facebook. It was from Jen McBean, who says, having sickle cell trait, I was diagnosed with pernicious anemia and had to get B12 shots. White blood cell counts were low for years. Yeah, so vitamin B12 deficiency can be from lack of B12 in your diet, like if you don't eat any animal products. So people who are what we call lacto-ovo vegans, they don't eat eggs, they don't drink milk, they have no animal products in their diet at all. Those folks can become B12 deficient. And then pernicious anemia means specifically that your body is unable to absorb the vitamin B12 in the gut. So you have to get injections of B12. So the next slide is more on like diseases of the, oh, I'm sorry, I didn't mean for you to go forward. I apologize. So this slide, I thought it was important to talk about other diseases of the blood forming organs like leukemias or lymphomas. We think of those as blood cancers. So as opposed to solid tumors, like a blood like a breast cancer or a kidney cancer or a bone cancer. Those are solid tumors. Leukemias are what we call liquid tumors. So they are cancers of the blood or the blood forming organs. And the blood cells, usually one line, will grow out of control. And so if you look at the graphic in the bottom right corner, there's a normal bone marrow, and you see that there is the whitish yellow is bone tissue, right? And then there is a certain number of cells or a certain percentage of the bone marrow that's made up of cells, versus in the upper part of that graphic, you see that the bone marrow is overcrowded with cells, and it'll usually be what we call a clone of cells, like all of the same cells just overly proliferating. And remember, we talked about you can have too much of a good thing. So when you have these high white cell counts, they can literally clog up your blood vessels. So I've seen people with leukemias have strokes or stroke-like symptoms. The cells can be so numerous that the cells will rupture or lyse or die off and release their cell products. So people can have excess of electrolytes like potassium, phosphorus in the blood, and the excess of those factors can cause derangements in the blood. And then in the corner, it's kind of small, but people who are experiencing leukemias and lymphomas, they can have symptoms like systemic symptoms. So they may experience unexplained fevers, so fevers in the absence of other illness, signs of illness, unexplained weight loss, frequent infections, excess bruising or bleeding, because when the bone marrow is so busy making all of these abnormal white cells, it's not making enough platelets, the clotting cells, right? So those people will have nosebleeds, bleeding gums, just bruises that they can't explain. They'll feel weak. They will have symptoms like night sweats, like drenching night sweats. I mean, you know, having to change their pajamas, having to change their bed sheets at night because they're sweating so much. They'll lose their energy, lose their appetite. They'll have swollen lymph nodes, so big, firm, matted lumps in their neck, over their clavicles, in the armpit area, in the groin area. They may experience chest discomfort or shortness of breath if the lymph nodes inside of the chest cavity swell. Their liver and spleen may become enlarged because the spleen is just a big giant lymph node. And so they have all of these different kinds of symptoms. So those are emergency symptoms. And those conditions can be diagnosed through a combination of blood tests and sometimes biopsy of the bone marrow. Next slide, please. Yeah, sorry to hear about that, Stacy, that you lost a friend to leukemia. It's a crazy, crazy disease. So we'll wrap up by talking about bloodstream infections. And there's so many other diseases of the bone marrow. I just like scratched the surface, but I wanted to talk about those that would be relevant in our community, like covering sickle cell, talking about thalassemia, talking about anemia in the setting of nutritional deficiencies, talking about diseases, just to point out what some of the symptoms of like blood cancers can be. And then lastly, I wanted to wrap up with infection. So here's 3 different examples of bloodstream infections. So the first one on the left is a graphic or a picture of a blood vessel, and you see those disc-shaped red blood cells, but those little blue rods, those are bacteria. And in the medical community, those rods would most likely be, or in the medical setting, would most likely be like a gram-negative bacteria, like an E. coli or Pseudomonas or Klebsiella. These rod-shaped bacteria that can get into the bloodstream and cause a condition or disease known as sepsis. And sepsis can be bacterial and sepsis can be viral, which the other 2 images depict. So the one that's in the middle and more towards the bottom of the sheet, that's actually a image of HIV virus, and those little points off of the virus are viral proteins. So HIV is a blood-borne infection, right? Blood-borne viral infection, and we know that most often it is transmitted through blood exchange during sexual contact, but it can be transmitted through intravenous drug use. It could be transmitted, not really through transfusion anymore, but years ago, that was an issue for people in the hemophilia community, people who would get plasma donations or transfusions or blood transfusions because they had excess bleeding, uncontrollable bleeding. They would be the recipients of blood transfusion so that they can get benefit from the clotting factors of someone else's blood. So the famous tennis player Arthur Ashe became infected with HIV virus when he received HIV infected blood before they were routinely screening for that. So when people are blood donors, or when people go in to become a candidate to be a blood donor, they are screened for HIV risk factors, as well as the blood is tested for HIV infection, viral hepatitis, certain parasite infections like Babesia and trypanosomes and other infections, to make sure that those bloodborne pathogens are not transfused to the recipient. And then the other graphic on the right side of the screen is actually coronavirus or COVID-19. And you see those little spike proteins that we talk about on the outside of the coronavirus, and those white structures on top of the virus are antibodies, right? So we have antibodies in our bloodstream that we will either develop because we had an active infection, or because we received a vaccine, we produce antibodies, and when we're exposed again to the virus, our antibodies are primed and ready to attack it, so that if we're vaccinated, we don't get sick. Next slide, please, Kenyofu. So talking about sepsis, talking about bacterial or viral bloodstream infections, there's a constellation of symptoms that goes with that. And typically it's fever, like high body temperatures, or low body temperatures. So a body temperature of 97 or less. People may experience shaking, chills, body aches, fatigue, lack of appetite, dizziness, lightheadedness, and those are emergency symptoms when you are experiencing an infection. So it's important that you seek medical care, because the way that we prove that you have sepsis is through objective measures. So is your white blood cell count high or low? Is your blood pressure low? Is your heart rate above 90 or 100 or above your baseline? Do you respond to fluid resuscitation? And it's critical to identify the infection so that we can treat you promptly, either with antibiotics or antivirals, or like if we were talking about COVID-19, give you one of those plasma transfusions, or give you an infusion of antibodies that are made to go and fight and attack the infection, and to be in the medical care, or be in critical care until we can stabilize the body, because sepsis and bloodborne viral infections or bloodborne bacterial infections can really cause devastation and wreak havoc on the body really quickly. So we have to manage those symptoms really, really quickly before they really take the toll on the body. So I'll take a few questions. Louise said she had a patient who had been infected with HIV as a result of having a hemophilia diagnosis. And then I'll have to wrap up at like 8:35. So just a few questions before we close out.
Teresa has her hand up.
Oh, Teresa, I'd love to hear from you. Hi.
What I would like to say is that how do we like my sister had sickle cell anemia, suffered, and my other sister was dealing with lupus. And a lot of times we're dealing with both of those things. Like you said, you go into the doctor, they don't want to treat, they don't want to, like I told the doctor, I said, I would like to be tested for these things, but they don't want to test you for that. And
for
so
sickle
that's
cell and lupus?
Yeah, it's like I told my medical doctor that my sister, was sick with the sickle cell. That she had a sickle cell trait. She was real sick all the time with it. And my sister was dealing with lupus. And so when I spoke to my doctor about getting tested, it's as if, they're like, oh, well, you don't have the symptoms. And a lot of times
But that
we've had
doesn't
similar,
matter. That's important to know, even if you only have the
right,
trait,
and
because
right,
under extreme stresses, some people with trait will go into crisis. So it's important to know if you have the trait, so
exactly,
that you can present that to your medical team if something's going on. So you
right,
need what's
because
called a hemoglobinopathy screen.
okay,
And a hematologist or an oncologist would be a doctor who could also screen you for that.
right, because the doctor at the oncology asked me about that the other day. She was like, I see that you that they were saying something about you had some kind of sickle cell thing, and I said yes, ma'am, but no one has ever dealt with it. So
Mm-hmm.
so that's why I was surprised that she asked me that. When when like you're talking all this stuff now, and so
Yeah.
it's not that I wanted this stuff. I just wanted to know
You just
because
need to know, because
you
there's
just need to know,
implications there.
right? But they just seem to be like just they don't want to deal with certain things. You ask them certain tests, they don't want to deal with it.
Mm-hmm.
So it's like how can we change that system where people are hearing us? I mean, it's like even sometimes changing a doctor doesn't seem like, especially like you said, the thing with the Black people, it doesn't seem like they want to
Yeah.
hear us when we
Yeah.
educate it. That's what
Yeah.
my problem is sometimes with the system. Like Jackie says, systematic racism. I feel like that's the problem, that they don't want to deal with us properly when we know stuff and we ask them questions.
Yeah. Sometimes people, especially healthcare professionals, are unwilling to say they don't know something.
Mm,
But that's a dangerous thing, to be unwilling to say that you don't know something, or to not know that you don't know something. Because that would be important to just tease out, and it's a simple blood test and it would be covered by your insurance. So when we don't have doctors who are culturally competent, they may know other things, and they may know things that are relevant to most of the people in the population. If they're not for us, they're not for us, and we have to move on. If we don't have access to other providers, though, we can advocate for ourselves by providing the information. And sometimes it's as simple as, can you order me a hemoglobinopathy screen, because I need to know if I have sickle cell trait or not, because it can impact other aspects of my care, and insurance will cover it.
thank you. I will speak to my doctor about that when I go in.
Yeah.
Thank you so much.
Yep. All right. Any other questions? Anyone else with their hand raised?
Yep, Jacqueline.
Okay, Jacqueline.
Hi. Okay, good.
Hi.
My camera wasn't working the last few days. What Teresa brought up was so important. I went to the doctor yesterday because I had a really bad neck pain and headache. And they didn't know. So they just were like, oh, they gave me Valium, they gave me some other kind of muscle relaxant, all this other kind of stuff. I went to the neurologist yesterday, and he gave me every option that there could possibly be. And he's ordered so many tests that I have to take now, because it's even an indication of cancer. So
Yeah.
he's like, no, you have to go get this, you have to go get that, you have to go get the other. And I was so happy, because I've never had, since my last doctor that retired, someone who was so complete.
Yeah.
And it's like, we need to know, like, I really wish, I don't know if there's a book out there or something, a simple manual for Black people when they go into these doctors' offices and hospitals to ask for specific things. I'm very adamant about certain things. They'll tell me no, and I will go off. So they give me what I want, and they will give me the test that I'm asking for. And they'll tell me insurance. Well, don't tell me about insurance. I'm not.
Right.
You tell me what I need. I will fight with the insurance company, because
Right.
clerks making those decisions, not doctors.
Exactly.
So I really would like us to have some kind of booklet or something of standard of how to speak to medical professionals and get what you need, because this is the biggest issue right here, that we're being ignored, that we're being told, oh, poo-pooed away, all this kind of, I'm hearing about too many deaths. It's in the Black community. So
I keep saying I need to write a book, because I don't know of one. It doesn't mean that one doesn't exist, but I don't know of one. But I keep saying I need to write a book on how to interact and engage with the healthcare system. And it would be a simple thing to write, like head to toe. What are common ailments? What are the symptoms? And, what would be common tests? Because we need to know how to advocate for ourselves,
That's true.
I
didn't want to interrupt you, but I wanted to tell you what happened to me. I had I have a meningioma, which is a
Mm-hmm.
small tumor, but it's not. They told me it was in the rear occipital right part of my brain, and they were like,
Okay.
"I really don't want to go there and operate
Right.
it." That and the other.
Exactly.
But when I went to the neurologist yesterday, he took the slides of the MRIs and he showed me. He said, "Look, here's yours from 2 years ago. Here's yours from last year." He said, 2 years, the tumor itself hasn't changed, and it's benign, but it's in the sheath or whatever the covering of the brain is.
Mm-hmm.
And it's starting to exert pressure. And he said that may be where my neck pain and my headache was. It's like a migraine. I never had a migraine before, but this was crazy.
Mm-hmm.
So he said he showed me where there was pressure being exerted by this little thing. He said, I could have had it since birth. He said they're very slow growing. But he was like, he recommended that I see a neurosurgeon and that they take it out so that I wouldn't experience these pains. But he's going to do all the other testing for all the other, options.
Yeah, just to be sure.
Yeah, and then he, recommended a really, he said what he considers a great brain surgeon, neurosurgeon. So, and he said it's a 15-minute surgery. And he said,
wow,
I was advised 2 years ago to just look at, wait,
keep an eye on it,
whatever. And he said he doesn't agree with that. He said not in this case, because you could clearly see the pressure's being exerted now. And he said, I don't want you to wait 5 years from now and then it gets
and it's too big.
Yes,
it's inoperable. Absolutely.
Yeah. So I was like, wow, because I've been waiting. It's 2 years now.
Yeah. Oh my goodness. Thank you for sharing your experience with us. Any other question before we get to wrap up and close out?
There's no hands raised.
Okay. Well, I thank you all so much for rocking out with me. It's so great to be back in this space. I certainly will schedule myself to be back on because there's so much to talk about, things happening in just in the world, but their impact on the Black community. We're dealing with COVID. We're talking about the vaccines. And although I'm not someone who is, I don't want to force people or convince people. I just want my people to make an informed decision. I want my people to make an informed decision based on the facts. And so I definitely am going to plan to come back and talk about that with the community. Terry says she has cerebral palsy. She switched many of her doctors to African Americans, and she maintains a specific insurance because of control and access to care to her specialists. That's so critically important, being able to see doctors who can provide you the care that you need, being able to have access to subspecialists. All of us may not be able to see a Black doctor, or we may have to travel and jump through some hoops to see a Black doctor or a brown doctor or a Latino doctor, or even just a culturally competent doctor, because there's not that many of us in medicine. Black women are only 2% of doctors. I think overall Black people are like less than 5% of healthcare professionals. And the more subspecialized things get, the less of us there are representing. And so if we can't find a Black doctor, we need to find a culturally competent doctor. And sometimes, going to the doctor around the corner or on your block is not the best option if they don't provide you with great care. Sometimes you gotta travel, and that's okay, because there's nothing that is too much or too great for these wonderful bodies of ours. So let's go to the slide and see who's coming on next. Oh, that's so wonderful. You see a Black neurosurgeon, Jackie. So for the Wake Up community, my offer still stands. If you go to www.dralexea.com, and I'll make it easy for you, if you put in /supplements, you can get a 15% discount. Also, I do offer a free 20-minute consultation on the supplements, because again, right, I mentioned several times, you can have too much of a good thing. And right now during COVID-19, there's definitely some supplements we would want to consider taking. The rules are a little different with COVID-19 in terms of how you supplement. There are things that you may be taking that you should discontinue if you have a COVID-19 exposure or a COVID-19 infection. And so that would definitely be something worthwhile having a conversation about. So if you email me at agaffneyadams.com, we can schedule a consultation and we can talk about that for you. Okay, next slide, please. So my contacts, keep it simple, y'all. I'm at Dr. Alexea, so you can follow me on Facebook, Instagram, and Twitter at Dr. Alexea, DRALEXEA. I am always, always, always in the space of educating and informing our community about issues that relate to the health of Black and brown people or BIPOC people, people living in these brown and Black bodies, these not minority bodies, these major bodies. Because things can be a little bit different for us. And so I really emphasize being a source of information and knowledge for our people that pertains to us. Next slide. And then for love offerings and donations, which we so greatly appreciate. Remember, you're supporting your speakers, you're supporting me, as well as supporting our phenomenal, phenomenal, phenomenal team who keeps Wake Up coming to us every single day. So you can do soulleadershipdevelopment@gmail.com for Zelle or QuickPay, or you can Cash App $ Spirit of a Woman. And the code for today is 265AG with 265 days in. That is so amazing. Next slide. And coming up tomorrow, we have Shakia Purple Norris. She's going to be talking about hip hop, roots and culture. I love, love, love always the reference to hip hop music, our culture, and all aspects of our life and our culture. A friend of mine who is a physician wrote a book about music and medicine, where she outlined all of the diseases that famous Black artists had and, died from or dealt with. Like she talked about Bob Marley's skin cancer and, talking about one of the rappers who dealt with diabetes. So really cool to be in this space of talking about hip hop and our roots and our cultures and the impact that the music has on our community, because it is very real and it's very relevant. Next slide, please. So remember the Wake Up Everybody schedule. We're doing Zoom live workshops Sundays, Tuesdays, and Thursdays from 7 to 8:30, Mondays and Wednesdays from 7 to 7:30. And remember, all of our Zoom live workshops are also streamed live on Facebook. If you, excuse me, if you haven't already, make sure you join the Wake Up community. And you can stay in touch with the Wake Up community. You can register to get the emails, get the links, get the reminders, get the schedule. So bit.ly/wakeupmovement or bit.ly/WUE community. We are on Instagram at Wake Up Everybody Virtual, on YouTube at WUE or Woo on YouTube. And you can email us at info.wakeupseries@gmail.com. And thank you guys so much. If you're interested in becoming a member of the Wake Up team, reach out, send an email to connect with the Wake Up virtual team to keep this machine running. It takes a lot of behind the scenes effort and a lot of folks involved to produce this amazing show that you guys get to see every single day. So many hands make light work. And so definitely reach out and connect with the team if you're willing to come on and be a support.
And also today being Thursday, you have the opportunity to stick around. Kathy will be here to show you, to tell you, to talk to you about what it means to be an admin, to be a volunteer with Wake Up Everybody. So stick around. Don't leave us after the shower for Alexea. And now we can shower Alexea.
Thank y'all.
Amazing.
We love you.
Thank you,
Queen,
Alexia.
thank you so much.
Thank you
Thank
so
you,
much.
Dr.
Best in
Alexia.
the
Very
world.
much.
Thank
Thank
you. I was
you.
just
Thank
trying to
you.
work.
Thank
Girl,
God bless you.
girl,
you.
you
Thank
had
you.
Thank you.
Thank you.
Love you.
Thank you,
Thanks
Shawnee.
so
Oh,
much, Doc.
thank
For your
you.
Your
energy.
Thank
beautiful
you.
presentation is
Thank you,
Much
always
abundance
Thank
and
you. Thank you.
get
manifestations
our
to you.
Oh,
God.
We are looking
keeping us
forward.
alive.
oh,
Thanks,
Thank
Alexia.
Spirit
you.
already dropped it in your spirit, so you have to do it. Thank you for
Very
your
empowering.
knowledge,
Thank you.
your wisdom, your love, patience, understanding, resilience, cash app family. Let's cash app.
Thank
And your
y'all.
beauty.
Be a
Thank you.
Thank
Thank
blessing.
you so
you.
much.
Yeah.
Enjoy your
Thank you, Shawnee.
breakfast. Thank
Thank
Thank you,
you.
Shawnee. Thank
Oh,
you. Wake up,
thank you,
everybody.
Infectious,
And
advocating. Thank you.
thank you so much. This is great.
Yay.
Yeah.
Shawnee, you have
Everybody
Hang
homework.
be
back if
safe.
you're gonna
Have a great
volunteer,
day.
guys.
Love
Take
y'all.
care, everyone. Thanks for
Have a
all
great
the
day. Peace and
love. Have a
blessing.
great and productive day.
Yes,
Even if
you.
that means you rested. Rest is productive also.
Yes. Have a great day.
All right.
Bye.
Take care, everyone.
Love y'all.
Bye.
Love
Bye.
y'all. Mwah. Peace and blessing. Hey. Hey, sweetie. Oh, are you trying to get me still again?
Every week. Hey, Moto E6.
I don't. Oh God. That's Kira.
Yeah, Kyra Harris.
That's Kyra. Hi,
Kyra.
Kyra. Kyra. Her name is Kyra.
Kyra. Yep. Hmm. Well, I mean, while we're on and we're still in the Facebook space as well, do we just want to talk about what does like volunteering look like behind the scenes? Yeah. Oh, my name is Teresa Plaskett. I am 48. I don't know if we gave our ages, but anyway, um, I am a slides team member along with Kathy. I'm an onboarder, and an onboarder is someone who will reach out to the facilitators before their presentation just to make sure that they are together, whatever they need in creating the slides and supporting them for their presentation, and also a volunteer outreach person with Kathy as well. And I'm complete. I'm going to pass it to Teresa Scott.
Hi. Hi, my name is Teresa Scott. I was laughing because I was trying to click off and then I was like, okay, Teresa, here, so forget about it. But my name is Teresa Lorraine Scott. I am 62 years old. I recently joined to work to be a volunteer to learn how to do sliding, but I've been having a difficulty with getting a computer still, so that's the still thing I'm working on. I have been looking at different funding, so I have to meet with Shauna, to make that appointment. But I am, looking at different grants and stuff like that. So, and been having a challenging week, but when I get on here, it kind of helps the week, not be as challenging. So I'm grateful for that.
Thank you.
All
And I'm gonna pass it to the
Cool.
Kojo.
right.
Is that
Kojo,
cool?
you came on. Hi.
Yeah.
Hey, peace. How y'all doing, family?
All right.
Good.
All
Thank
right.
you.
I just wanted to stick around and hear about, but I got cut off and whatnot, so I had to come back. Hear about what the volunteer opportunity is, what you guys are needed, and things like that. I do have a lot going on, so I'm being very conscious and intentional about, taking on more things, but I wanted to more so be aware of what you needed and where I can possibly see myself contributing in the near future.
That's
Um,
wonderful.
you were asking the age and things like that and what we do.
Yes.
Oh, okay. I'm 50 years old. Um, I am a musician, teacher, professional musician. I teach Djembe, West African drumming. I've been doing that for over 20 years now. I'm professionally a paraprofessional with Board of Education. Also do volunteer work in terms of mentoring young men and young women, but particularly young men, um, with two separate men's uh, circles, men groups, um, Parliament of Soul, as well as the Brothers of the Sacred Drum Circle, Sacred Drum Council, excuse me. I'm complete.
Thank you so much. May I ask you, if you wouldn't mind, first off, so if you wouldn't mind, if you have the ability, I know you're driving, but to
Mm.
put your information for me in the chat. You can send it private if you want, but if you could put your full name and your phone number in the chat, so that I can add you onto the volunteer interest onboarding that Kinyofu does. It won't be tonight, but it'll be next Thursday. And
Okay.
we have a number, and there's also a link. Do you see the link? Do you see the link in the chat?
Yeah. Hmm.
Okay, if you could also fill that out. And it gives information about the different committees that we have and departments that we have. The need is great. I mean, there's so many different departments according to that might suit you. We have a marketing department that has like social media and just so many different things, ways to engage the community. There are on documentation teams that actually create manuals and go over documents that we have, and they create our infrastructure, if you will. There is the slides team, and Teresa and I are on that team, and we actually create the slides that you see every morning, the slide deck. And as today, when the facilitators send in their send in their slides and so forth, we incorporate that into the slide deck and prepare it for the mornings. There are uh, community outreach, and when we give that information on the contact us slide, and people like send emails in and questions and so forth, then we have people that handle that. And the marketing team also, I didn't want to just, there's so many opportunities. If you're talented with video, there's that. If you're talented with social media, Facebook, we're looking for a Twitter person. We're going to actually create the Twitter account. We do Instagram, we do YouTube, we do video snippets. There's just a lot to be done in the marketing department alone. There is a core committee, there's facilitator training committee, which Robin is on, and she hasn't spoken yet. Rob, are you there? And I didn't mean to ignore you or anything like that. Can you come off mute? She might have stepped away from the mic, so to speak. But there's facilitator training, there's and mentoring. There are, Teresa, you could thank you so much, Kojo, for the information. Teresa,
Sure, yeah.
what else am I forgetting? What committees am I
I mean, I think you summarized a lot of the committees that we already have. And also there's space to also create as well,
yeah.
right? So bringing in your own talents and gifts and ideas into the space. There might be a need or some other aspects of this whole Woo Nation that, that needs covering. So, it's not necessarily limited to, these particular committees. What else, you're bringing your whole self to the table. So, listening to the different experiences that you have as well is just as important. And, we're here to create. So I think, that summarizes a lot of what we do.
Teresa Scott came in, and we didn't even know she has a talent with fundraising and knowing, having a lot of information and just knowledge about grants and things of that nature. And that's something we didn't. Oh, there's a finance committee also, by the way, that deals with like the donations. There's an admin committee that does the general admin work. But Teresa came in with that knowledge, and that's something we didn't even realize that we needed, but we do. So she's, coming in to add that information and bring that aspect of her. So if you see a need, you're a creative person, so there's a lot of social media, that interaction that you might have a creative ball with, so to speak. And yeah, bringing you, it's a continuation of the whole process. It's not just duties and so forth. And the different committees have different time requirements. So that's also something. Teresa and I, like I said, are on slides, and that has a different time, a time commitment where you are able to create maybe after hours or on your own schedule, as long as you get it done by a certain time. And the different committees have maybe less of a commitment, some have more of a commitment. So that's also something that can, that can be explored. And it really is, like I said, a continuation of the whole Woo Nation and the whole healing process. The volunteer committee is, it's a family, and it's just more healing on a continual basis, because you're like I said, you're bringing all of these woke people, all of these healers, all of these mentors, all of these light workers, all of these, all of these. Let me just say, with our individual talents, gifts, and abilities. So it truly is a rewarding thing, and it's something where you learn so many skills that are marketable, that you may not known that you needed or wanted or could have. So do you have any questions?
I was trying to. I'm actually in the store right now, but I'm looking at the list and just trying to look. But I don't have. I don't really have uh, any questions at this time.
Okay.
More so, I'm just looking at the list on the Google form here.
Okay. Okay.
Yeah.
You can drop because I'm on the community outreach team, so you can, if you have any questions, just drop an email. Do you have that? You have the contact information, correct?
I'm sorry, I said it again. Do I have
You have the, well, actually what I'll do is I'll text you, And
Okay.
if you have any questions, or I'm also going to add you to the WhatsApp thread for volunteer interest, and Kenyofu will reach out to you to just give you like an
Okay.
overview of the
Right.
volunteer process, and from there she'll have a conversation with you, and she will direct you towards the team leads. And the team leads, depending on what you're interested in finding out about or being trained in, and then the team leads will get back in touch with you.
Okay, gotcha. All right, that's
And
good. Yeah, that's fine.
okay, and guys, anybody have anything to add to that?
Yes, I just wanted to ask a question. What is your organization that you have called The Hand? What does that do?
That is my business. The name of my company, which is the Hand Arts and Entertainment, and that is how through this business form is how I consult with schools and community-based organizations to teach West African drumming, as well as do performances and things like that for professional performances.
Oh, okay.
So I've been teaching djembe, for under this banner. This is, like I say, this is my consulting company for arts and education. Mhm.
Beautiful.
That's
Beautiful.
beautiful. Thank you.
All right.
Yes.
Okay.
Thank
So,
you. Yes, thank you.
oh, um, thank you for asking that, Teresa. That's a great logo. That's a great
That's
logo.
that's that's what made me ask the question, because I saw the
Yeah.
hand. My
Mm-hmm.
mind just went like way past the hand. You got to touch or something, you know.
Oh,
Yeah.
yeah. Thank you very much.
Oh man. Okay. All right. So, we will, I'm so sorry. I don't mean to cut you off.
Hmm.
So
No,
we
I
will
was
be
just
in
saying.
touch. Yeah, I'm sorry. Go ahead.
I'm sorry.
Go ahead. What were you saying, Kojo? Oh, you're muted.
Oh, he might be.
You are muted. Okay. Well, we will, I'm going to put your information in the WhatsApp thread, and we will reach out to you. And if you have any questions, just put them in the chat, and one of us will reach back out to you and get any questions that you need answered.
So Kathy, excuse me, when is our next meeting? When you are supposed to do another training? Because
Saturday. I'm doing a training on Saturday
at what time?
from 1 to 2:30.
Okay, I gotta let you know because I know I have an event that I have to do on Saturday.
Okay. Well, we can arrange another time. You can
Okay.
always come on and
Saying
do
I might, I don't know how long the event is. I gotta find out today how long the event is, and if it's not, if I could just leave and come back, I'll just do that. It's not a problem, because I don't want to be missing training. And then our next one is for the Sunday, like the first Sunday in March at 10 o'clock.
That's the general meeting. Yes.
Right. Yeah. No, I'm just saying.
Yes.
Came up on my calendar. Came
Yes.
up on my Google calendar.
Yes.
I was like, oh yeah, that's good. I like that.
Okay.
Okay.
All right. Teresa, you and I can discuss that. And Kojo, any questions or anything else before we end?
Sorry.
Hey,
Yeah.
Adam.
Yeah. I'm looking at I'm looking at your community liaison.
Mm-hmm.
Okay. But no, I'm good. I'm good. Yeah. Let me not take any time.
Okay.
Right now.
Okay. All right. If you have any questions, like I said, I'm going to add you to the WhatsApp chat right after this. And if you have any questions, just drop it in there. And it's, very responsive. So one of us will get back to you right away.
All right. Wonderful.
All right. Thank you. Thank you so much for staying afterwards. Have a beautiful day, everybody. And I'll talk to everyone soon. Thank you.
Okay.
Thank
Right.
you.
Hey,
Have a
Adam,
good
you okay? Adam, you okay? We didn't hear from you today.
I think maybe, people don't sign out and
Oh, yeah.
like Moto E6 and Keys to Abundant Life and Robin.
Mhm. Okay, sweetheart. Y'all have a great day. God bless.
Thank you.
Sorry,
too.
y'all. Good night.
Oh, there you
Good
are.
night. Lord have
Oh my
mercy.
gosh. It's okay. I'll call you in a minute, Rob.
Don't, okay.
Oh, I'll call you later. You call me then. All right,
Yeah.
Teresa. Talk to you later.
Later, peace and blessing. Bye-bye.
Bye-bye.